Hi everyone, this is Rihanna Palmer. I will be presenting on discrete child teaching today. So here we have our table of contents. I'll go over an introduction, what is an SD, the three-term contingency, positive reinforcement, negative reinforcement, punishment, maintenance, generalization, and then some conclusions. So first, an introduction to DTT. Discrete child teaching includes a discriminative stimulus or an SD, prompts or prompt baiting, dependent on the needs of the client, reinforcement strategies and schedules, as well as some sort of error correction procedure. It's been proven to improve skills regarding imitating actions or functional skills across children on the autism spectrum. But it doesn't have to just be these designated skills that I've listed. It can also include listener responding skills, responding to intraverbals, like if someone were to ask a child a question, identifying items, also identifying numbers or letters, receptively identifying them in a field of 3 or more spread across a table with a few cards laid out. More information about what is an SD. This is known as a discriminative stimulus. It gives an indication or it's a cue that some sort of reinforcement will be soon available. So some SDs that can be used when running some of these DTT sessions can be varied by using different phrases similar to do this, copy me, do what I do, you try, as cues for the child to complete the action to gain whatever they're trying to get for reinforcement. So their reinforcement could be an iPad. It could be playing games on a phone. You could be using Play-Doh, sand, sensory beads, toy cars, toy food, whatever the child finds to be reinforcing for them. Here, we'll talk more about that three-term contingency. So this includes an antecedent, a behavior, and a consequence or reinforcement. So an antecedent, this is basically what happens before a behavior occurs. It could be something that's verbal or nonverbal. It could also be anything as far as loud or noisy environments, crowded places, eating or not eating breakfast, getting a good night's sleep or not getting enough sleep, anything along those lines. There's always going to be some sort of antecedent for every behavior that occurs. So for example, when someone is hungry and they go into the fridge to eat, their antecedent for going to the fridge could be the fact that they didn't have a nice breakfast that morning. So behavior, this is going to be any observable action that is seen. This happens directly after the antecedent. And some examples of different behaviors that we see could be answering a question, laughing, hitting a person, throwing items, eating or drinking things. And in the case of doing DTT sessions, the behavior could be correctly identifying the item that we're trying to get the child to learn, or touching the body part that we request. For example, if you say touch head, that's your antecedent. The behavior would be the child touching their head. And a consequence. So this is going to be what happens after the behavior. It can be either positive or negative reinforcement. So some things to think about would be, was the child given attention? Were they given access to an item, escape from a demand or a task, or other sensory things such as the lights being turned on or off, using a Chewy, or listening to music? So more so talking about the DTT three-term contingency. This is within sessions. There's always going to be the SD, which is going to be our antecedent, that discriminative stimulus or a signal or a cue. It's going to be an instruction or anything within the environment that can motivate a learner to evoke a response. The learner's response would be the target behavior. So it could be them correctly identifying what we're asking them to, or it could be that they're incorrectly identifying what we're asking of them. And thirdly, there's going to be an identified consequence contingent on a correct response from the learner or reinforcement. So what they're gaining depends on what they correctly responded to. An antecedent, so for an example, an antecedent could be copy me. The behavior could be the learner correctly imitates the action. So for this case, it could be copy me, putting a thumbs up behavior, learner correctly puts their thumbs up. The consequence could include positive reinforcement by the learner gaining access to a tablet or candy, whatever their actual reinforcement preference is. So here I have a video example.
Keep this up.
So here they're getting to sample the items. We're figuring out what the learner finds reinforcement.
Okay.
Always going to want to do this before starting the session.
This thing? Okay. Awesome choice. We're going to put it right here. All right, Cardi. Okay, are you ready? Point us. Hold on. Point to Marshall. Yes! Great job! High five! Good job! All right. Point to Sky. Point to Sky. Good job. That's Sky.
So this is the error correction.
Point to Sky. That's Sky. Parker. Two. Focus. Two. Yes. Perfect. Cardi. Point to Sky. Yes! Excellent! Here is your stand. Wonderful, sweet girl.
So in that case, we had the instructor saying, point to marshmallow. The learner pointed to marshmallow and immediately got the reinforcement. When the learner did not correctly touch Sky, which is a dog from Paw Patrol, the provider then used error correction before giving her access to that reinforcement, which was the sand. So with positive reinforcement, this is going to be adding something to the environment in order to increase those target behaviors that we would like to see. So before conducting a DTT session, it's important to have knowledge of what reinforcers will be motivating for the learner. This can be done by using formal or informal assessments, and it can identify what reinforcers will work for this learner. And then the schedule reinforcement can then be created by the BCBA that's maintaining the case. Negative reinforcement, this would be involving anything that takes away a stimulus in order to increase more socially appropriate behaviors. Some examples may include giving breaks after completing tasks, honoring alone time, alleviating chores, etc. Negative reinforcement can also be given during DTT times when offering those breaks, or when teaching these skills to learners by having them ask for more time before removing a tablet or a puzzle. Punishment, this is something that we don't really want. It's anything that causes a decrease in behavior. So this could be timeout, being grounded, taking away items, or not honoring breaks. We never want to do anything that's going to decrease these behaviors. We always want to jump to positive or negative reinforcement first. And maintenance. Studies have shown that continued maintenance of skills gained through acquisition training can have higher treatment integrity. So this basically means that when there is continued checks of making sure that the learner has maintained these skills that we taught them during these DTT sessions, it will have a higher rate of a successful intervention. So DTT training sessions for parents has also proven effective in increasing the skills learned through acquisition training. This could be due to the team all being on the same page and following the specified protocols that are written by BCBAs. In generalization, this should occur over people, environments, and context. So it could be as simple as changing up those pictures. Like for the example of when the learner was touching marshmallow, we could have it be the pink and green and white marshmallows, marshmallows with peppermints, marshmallows that have chocolate on them, instead of just showing a generic basic white marshmallow. We could also use different phrases when delivering those SDs. So saying things like, show me the marshmallow, show me the button, find the sky, where is the so-and-so? All these are different phrases that can be used. We can also generalize by having other people or peers run trials during these DTT sessions. So if you're ever in a room or in a space and you're working with a kid and you want to try to generalize a skill, you can have someone else in the environment ask the learner what you're trying to ask them. Also, trying imitation skills in various rooms around the center, home, or the clinic. These are all different ways that skills can be generalized. And so I have just a few conclusions that DTT, it should have a clear start and finish. Reinforcers should be identified before conducting the session. And then we should always follow the reinforcement schedule that's identified by the BCBA. And then these are the references that I use.